Dr. Billing, please tell us about the background of TMC.
TMC, or European Telemedicine Clinic, was founded in 2002 by 4 Swedish entrepreneurs and radiologists. The aim was to provide subspecialized radiology services to any part of Europe, irrespective of where the radiologist or the patient may be. So it was to improve radiology as such for the benefit of the patients, but also the working conditions of the radiologists, improving the reporting environment. In 2007, we extended the service to also include overnight on-call emergency reporting from our office in Sydney, Australia, taking advantage of the time zone difference. So the radiologists in Sydney, they report daytime on the nighttime emergency cases from Europe.
So how many hospitals or imaging centers and how many teleradiologists are participating in this?
In total, we are now, after 13 years, around 130 radiologists involved, not everyone full-time. Around 40 of them are full-time radiologists and the rest are collaborators on different time commitments. And they can be placed anywhere over the globe. The majority are in Europe, but then there's also around a dozen or a little bit more in Australia, a few in North and South America, Asia, and even in Africa.
So very much in general, please tell us about the penetration of teleradiology in Europe.
Actually, teleradiology is, I would say, it's a tool in radiology, irrespective of where you are reporting from. If it's done from the building just adjacent to the hospital, that's also teleradiology. What we are doing is providing an outsourcing or insourcing reporting service via this tool, teleradiology. The situation for the patients all over the world now is getting more and more difficult because the population is growing. People are getting older and older. They are more prone to get sick, but also the treatments are getting more and more sophisticated, and that needs a lot of imaging. The number of radiologists is not increasing, rather the contrary in many parts of the world. So that puts us into an impossible equation. And one of the measures you can take then is to outsource part of it to a dedicated reporting service where we don't have to bother so much about the routines of the hospital. We can concentrate on reporting. That is also a little bit of a disadvantage because the risk is that we get detached from the clinical environment, which puts a lot of stress on our communication with the hospitals, both with the radiology departments and with the referring clinicians. And there we have to work very hard not to be separated from the clinical environment.
What about laws and regulations in various countries? Do they interfere with cross-border teleradiology?
The patient data security regulation puts some, I would say, obstacles or difficulties in this work. For some countries, the patient data are not allowed to leave the country borders. What we have to do then is to anonymize or pseudo-anonymize these cases. So instead of seeing Mr. John Smith, we see a number or a code, which then is de-anonymized again when the report comes back to the hospital. It's a difficulty and it's a rather cumbersome workflow, but for some hospitals or some countries, that is the only way to work. The regulations for a radiologist doesn't differ so much in the different countries. What we must make sure is that the reporting radiologist is registered as a specialist in the country where the patient comes from. So we have to be licensed in the different countries where we report. Within the European Union, there's not so much of a problem because it's a paperwork.
And with regard to Sydney, Australia?
Sydney, Australia, For example, we have hospitals in the United Kingdom sending images to us. These patients must be anonymized. They come to Sydney, we report on them. We are all registered as specialists in radiology in the United Kingdom. And when the report then comes back to our operating center in UK, the reports are all, again de-anonymized into the correct name of the patient.
You've described several challenges with regard to communication of radiologists with the clinical peers. What about the setting of image acquisition and the situation regarding the patient? Is that very much different teleradiology-wise compared to real-life radiology?
No, I wouldn't say so. The scans are done according to the local protocols, and in many cases it's not until afterwards that the hospital decides which cases are going to be sent to telemedicine clinic and which are going to be reported in-house. So the scans are the same. We have some influence on our wish list of how the scans should be performed based on our very large experience. But that is in close collaboration with the referring hospital. The image transfer is, I would say, the easiest part of the whole work. Luckily enough, the digital images are based on the same standard, the so-called DICOM standard. So it's not much difference if we look at an exam on one technical platform in Europe or another in Sydney or wherever they are. They're all based on the same standard.
Are you using one centralized PACS solution?
We have a PACS of our own with one PACS server in Barcelona and one in Sydney. We have also a RIS system, Radiological Information System, that we have built in-house to adapt to our needs because they are a little bit different from the needs when you are based in a hospital. We don't have to care so much about the patient management, where to send the patient to which lab, etc. But we must make sure that we have full control over which radiologist is taking care of a certain exam and that it is reported on time.
What is the role teleradiology will have on shaping the future of radiology?
As it is today, I think that has mainly been used as a buffer to take care of the peaks that the local radiologists cannot take due to the lack of resources. But I think that in the future, or already from now, it's going to be more of a sub-specialized or super-specialized service. If we have, for example, 150 hospitals sending cases to us, even very rare scans will amount to a certain number when we get them. So we can afford to have a few very super specialized radiologists in one very small field reporting on these special scans, which a normal hospital cannot have specialists in every little niche of radiology. So that's where I think that that teleradiology or with this kind of solutions will play the most important role, super specialized reporting.
What is your intention with regard to the award for quality improvements in radiology?
As many used to say, that we are taking resources from radiology, from the already scarce resources in radiology in Europe, for example. And in a way it's true. We are using the radiologists from the hospitals, but we are letting them report in a very much more efficient environment, where they don't have to take into account clinical sessions, discussions with the clinicians, with the management, etc. They can concentrate on reporting, making them much more efficient. But we also feel that we are obliged to give back something to radiology and the radiology community. One thing there is this quality award, where we want to promote quality in radiology, because that will also be of benefit to us when we report. We are also already now taking part in teaching events like courses, inviting radiologists to stay for some time in our main reporting center in Barcelona, for example, concentrating on the type of exam that he or she wants to be more familiar with under guidance. which we have the volumes and the specialists to be able to do.
Dr. Kolokythas, your team is the winner of the Quality Award in this year. What have you done and what is special?
Well, we've developed an evaluation system for residents, particularly for radiology residents in our hospital, in order to standardize the way residents are being evaluated. And there was no system in place so far that kind of tried to more or less objectively try to rank or evaluate residents, and to give them feedback to what they've been doing. So our goal is basically to try to advance residents' developments by giving feedback, regular feedback, in a standardized way, by doing it in this kind of way that we basically did.
Please describe your team.
So we are a radiology department in a teaching hospital, a 500-bed teaching hospital of the University of Zurich in Winterthur in Switzerland. And we are 18 consultants, and of these 18 consultants we formed a core team of 4, including Dr. Straka, Dr. Patzwal, and Professor Binkert, and myself. And this core team of 4 basically were the ones who formed and created this evaluation system.
What are the benefits for the community of radiologists?
So if other members in the community would use a similar system, the benefit could be that they would also be able to evaluate the residents in a standardized way by applying the same criteria that everybody would apply to residents. So you try to standardize basically how you give feedback to residents and how you evaluate them, with the purpose of advancing their development.
How could others implement your approach and take it further?
Well, we are working on a system that allows us to share our evaluation system with other clinics and teams who are interested, basically as a package that you could share or download with others, so you have exactly the same electronic tools available and use them in your practice.